When I trained as a strength and conditioning coach, I did a few additional courses back to back, and the one I did in particular I found of great use for myself but also for clients that I work with, and that is a corrective exercise specialism. So corrective exercise is used basically to help reduce the risk of injury and to maximise performance, and that's why it complements any strength and conditioning program really well. It's also a great accessory that I've used with clients and myself when recovering from injury, surgeries, or ongoing niggles that you may have been carrying around for years. Corrective exercise focuses on the science of human movement, using advanced techniques to overcome any imbalances that you may have within the body. Hence why it's really good post-injury, because if you've been laid up, had surgery, then obviously that affected area hasn't been used as much, and there will be deterioration there, loss of muscle mass or stiffness in the joint. Using corrective exercise techniques reintroduces correct movement patterns within the body, and in turn it'll focus and condition not only the muscles of the body but also stimulates the connective tissue within the joints, which play a very important role in joint movement and stability. Today though, I really wanted to focus more on the use of corrective exercise as a fantastic tool for people coming back from injury, surgery, or as I said, just ongoing pains and discomfort within the body. If this is you, the first thing you should do, if you haven't already, is seek medical advice. So a medical professional will assess, then offer a diagnosis, and then refer you for some type of treatment, surgery, maybe physio, sports therapy, and you should obviously follow their guidelines. My role as a corrective exercise specialist really comes into play once you've been signed off from any medical practitioner that you've been seeing or surgery, and then I cover that grey area from that sign-off point for you returning to training at your full potential. It's all too common to see reoccurring injuries if this stage is not done right. And trust me, if you've been laid up after an injury or surgery, the last thing you want is another flare-up and then more time off, re-damaging an area that's already sensitive, and possibly even returning to a second surgery as a worst case scenario. I feel I can speak firsthand about situations like that because I've had quite bad spinal problems since my late teens, and these issues would flare up and incapacitate me for days, and then the worst case was about 3.5 to 4 months where I could hardly walk, which obviously kept me out of the gym, which I've always enjoyed, off the bike, which equally I've loved and missed so much time just trying to recover from ongoing issues. Now my issue being a mechanical issue is not going to get any better, but you just have to learn a way to live with it and deal with it and work around it. And then when I had a career change in my 30s and retrained as a strength and conditioning coach, and then took on several other advanced courses including the corrective exercise specialism, and I implemented these techniques into my own training, what with the help of a sports therapist and obviously my regular training, then I saw huge improvements and a massive reduction in my own flare-ups. And I think to date, in the past 10 years, I've probably only had 3 or 4 flare-ups, and they've been for a matter of days where it's just been uncomfortable, but it hasn't actually incapacitated me completely and stopped. And I put that down to the different techniques that I use and how I train now compared to how I used to. So what with my own experience and then also the results I've seen over the past 11 years working as a strength and conditioning coach that I've seen with my clients, from sports like mountain biking obviously, rugby, football, tennis, to name a few, and dealing with injuries like torn ACLs, collarbones, broken arms, broken ankles, broken fingers, and multiple other injuries. And then also working with people, which I've done quite a bit of, with hip replacements, knee replacements, and having the opportunity to take them through a well-planned corrective exercise program, and then seeing them return to training, to their sport, or simply just walking around the house pain-free, getting down the stairs without a stick. It's just really satisfying. And as I said, I'm a huge advocate and believer in doing the right thing at the right time, and corrective exercise really does work. So if this is you or someone you know and you think I might be able to help, then please get in touch. We can arrange to have a chat, and then we can put a plan in place, get you on the road to recovery, and get you back at it stronger than ever.